Hi, my name is Erin Chambliss. I am Miss Everdene's physical therapist. All right. Since you're her immediate family member, I thought
Right.
I'd talk to you about her current status. Does that sound okay?
Yeah, that sounds good. Thank
All
you so
right.
much for taking the time. Yeah, we really appreciate it.
No problem. All right. So I'm just gonna kind of give you a rundown of everything that's going on. I'm gonna kind of explain her vitals, what we found in her laboratory tests, and then explain kind of things that we found, symptoms that we that indicated that, and then what we will do and the appropriateness of how we'll do it after that. Sound good?
Sounds good.
All right. Okay. So we looked at her vitals, um, looking at her heart rate, oxygen, respiratory rate, blood pressure, things like that. All right. So first we looked at her heart rate. It was about 80 beats per minute. Could not think of the words, and that's pretty normal for her. So that's really good. We also looked at her oxygen. That was looking good too, around 97. So
Okay.
that's normal. Her respiratory rate was a little high for her age. Okay.
And what does that mean?
That just means that she's taking a lot more breaths within the minute than what is normal.
Gotcha.
So usually you're taking those breaths. She's working a little harder to make sure that she gets enough air into those lungs and things
What is
like
her
that.
number compared to the average?
Her respiratory rate is about 40 right now. So that's just a little high for what we're looking at.
Gotcha. You want to be around the 30, 25 range?
Around that like 20ish range.
Oh, okay.
And then her blood pressure, it was looking pretty normal actually. So that's good for her. Because you know, she's 82. She smoked for a while, but you know she had an acute episode of congestive heart failure, so that's why she's here. So
understood. Yeah.
looking at those things, want to make sure that she's okay. With congestive heart failure, some symptoms that we normally see, it's called tachycardia, but that just means that the heart's beating really, really fast.
Right.
And pretty much like, you know, it's working overtime, which is, it's muscle, so it gets kind of tired after a while. So we want to make sure it's working at the right pace. Pretty fatigued, short of breath when laying down, and sometimes she could have some confusion or some swelling as well.
Gotcha.
All right. And then some of the laboratory tests that we looked at her hemoglobin levels. If this is low, it can be an indicated risk of what we call like orthostatic hypertension. I know that's two big words, but that just means like when she stands up, change position, her blood pressure can just drop. And when that happens, people tend to fall, faint, get lightheaded, things like that. You've probably felt that sometimes when you get up too fast, but we don't really want that happening for her, especially with everything she has going on. So with that, we want to avoid like quick postural changes. We want to make sure we monitor her blood pressure, especially when she changes positions, slow progressions when changing positions. So don't just jump out of bed. Maybe get out of bed, sit on the edge of bed, and then get up. Probably experience some dizziness, some fatigue, but it also could indicate an iron deficiency as well. So we need to be on the lookout for that and look at those levels. Any questions about that? No. Okay. We also looked at her potassium. For potassium, if that's low, we call it hypokalemia. It's one of those really important chemicals that we need in that body. And when it's low, we can put the patient at risk for acute cardiac events, which is what she had. So this is kind of confirming what we saw. And then we also looked at her red blood cells. Low levels of that can indicate also an iron deficiency, and it can cause the heart to work harder than it should. So as you can see, the pictures being painted here for a lot of what's going on. It could also indicate some kidney dysfunction too. So you need to look out for that. We looked at her PCO2. If that's low, it could indicate also some kidney dysfunction. You could see some hyperventilation for her, and also it could indicate some lung congestion, which can not be good for her. So any questions on that?
Yeah, especially with the beats per minute being above average.
Yeah. 2 more things I'm going to list off for you for these lab values. We looked at her creatine levels. If those are pretty low, we need to definitely monitor for fatigue because it could indicate a fluid imbalance, elevated kidney function, or malnutrition. So we need to look at that. And then we looked at her BUN, and if that's less than 10, it could indicate that the patient is malnourished as well. Fluid imbalances, you might see it presenting like as a headache, and that means they would need some increased fluids. It could also present itself, it could also indicate some liver dysfunction as well. All right. So I talked about those laboratory tests. I'm going to tell you about what kind of lines she might be on right now. So she's currently on a ventilator. So yes, she's currently on a ventilator. It's helping her breathe. Her stats, she's on a CMV, which is kind of where we start off when she can't do the breathing on her own. And that just helps deliver the amount of breath she needs per minute for her. So you've kind of seen that in movies sometimes where, the machine's breathing for them. As we progress though, we should start seeing her move over to the next kind of stage of ventilation, which is called an SIMV, and that's where we start weaning. So that's where she can take some breaths, but the machine's gonna help with the residual. Like if she needs some more help getting enough air in there, or if she can't get a good breath, the machine will take over. Does that make sense?
Right.
Okay, and then after that, we'll move on to a CPAP. So that's when they can breathe on their own. They don't need a lot of volume of air, but they need that pressure to help push it. So that's what that CPAP's gonna do. And then after that, we'll move to like a nasal cannula where you see people that just walk around with that oxygen and things like that. So probably when we're moving her, when she's on the CPAP or that cannula, we'll have to be aware of those lines. She might have a catheter as well, so that just so she can go to the bathroom while she's in bed and things like that. And maybe she might have an art line as well, which is just gonna be right here in her arm. All right, so we'll make sure that we're aware of that when we move her and things like that. Let's see. We want to be aware of the fact that she could or might have a pulmonary embolus. So pulmonary embolus is just when you have a clot. Usually starts from blood clots in those legs, and it breaks off and it makes its way up to the heart and lungs.
Yeah.
And that can be kind of life-threatening. All right, so we want to make sure that we're aware of any symptoms that arise with that, which is that tachycardia that I talked about, the breathing fast, sudden change in breathing, particularly at rest, a drop in their oxygen. So that's why we want to make sure that we're always monitoring those values. You can always use one of those pulse socks that you saw people wearing a lot during that COVID time. And then pain in that chest or pain with breathing. So that's one thing we want to look out for. But to make sure that we determine the presence of it, we would probably do a pulmonary angiography or use like a Doppler ultrasound for that. So that would help us identify that and let us know that that's what is occurring. But if that does happen, we would definitely put her on a TPA, which is a clot buster. So that way we can get rid of that blood clot there. And then also just some anticoagulants, which that just breaks up the blood and keeps it from clotting up there. And then when a patient does have pulmonary embolism, we just want to make sure that they're hemodynamically stable. So that means that they just have good blood pressure. That means that all their vital signs are good in terms of moving them. And then after we've given them all the medication, we just need to make sure that they're responding well to it. And that they're on those anticoagulation medication, that anticoagulation medication. I think that's all I have to tell you about today. Do you have any questions for me?
Yeah, no questions. Everything makes sense.
All
Thank
right,
you.
well, sounds good. Thank you for talking to me, and I hope everything goes well.
All right, thank you.
All right, thank you. You have a nice day.